There are many people in the world who seek solutions to physical or mental health problems. To address these issues, the concept of treatment has developed based on medical diagnosis and therapeutic intervention. Therapy originates from the ancient Greek word therapia, which means to attend to, care for, or to heal. This concept has expanded into various forms and purposes, and among them, psychotherapy began in the late 19th century with Sigmund Freud's psychoanalytic theory. He argued that psychological problems originate from the unconscious mind and can be treated through language-based dialogue, known as the talking cure. So, what exactly is online therapy? Online therapy refers to the delivery of mental health services through digital communication technologies, such as video conferencing, email, and Zoom. This concept first emerged in the 1990s with the expansion of the internet and has continuously developed since then. In particular, the COVID-19 pandemic marked a turning point, as restrictions on face-to-face counseling accelerated the adoption of online therapy. Various studies consistently show that online therapy demonstrates similar effectiveness compared to face-to-face therapy in treating major mental health issues such as depression and anxiety. Online therapy is not merely a temporary substitute and emerged during COVID-19, but rather a form of care that continues to gain attention due to its structural advantages. Accessibility. According to Tazian, online therapy enables access to mental health services without geographical or temporal constraints through digital communication technologies. From a geographical perspective, people living in rural or remote areas can access therapy anytime using smartphones, laptops, or tablets, improving accessibility and convenience. From a temporal perspective, barriers such as scheduling difficulties, travel time, and waiting time are reduced, allowing individuals with busy schedules to participate more easily. From a cost perspective, expenses such as transportation, parking, and long-distance travel are reduced, which is especially beneficial for rural or overseas residents. This increased accessibility contributes to higher treatment adherence and lower dropout rates. Scalability. Online therapy enhances the scalability of healthcare systems by allowing them to accommodate more patients. From an institutional perspective, it reduces need for physical consultation rooms, facility maintenance, geographic constraints, and administrative workload. According to Cook, systems such as automated scheduling, electronic records, and mobile messaging improve operational efficiency and reduce clinicians' administrative burden. As a result, therapists can see more patients per day, and waiting lists can be reduced. It also helps reduce regional disparities in healthcare access by expanding services beyond urban-centered systems. Overall, online therapy increases patient capacity and improves the overall efficiency of healthcare systems. Privacy. According to Grodin, anonymity in online environments increases perceived privacy and encourages more open emotional expression. In face-to-face therapy, individuals may experience anxiety due to appearance evaluation, therapist facial expressions, and fear of social stigma. In contrast, online environments reduce social evaluation pressure, increasing psychological comfort. Receiving therapy in private spaces using anonymous accounts also reduces the risk of exposure and physical inconvenience. This environment allows individuals to discuss sensitive topics such as trauma, depression, family issues, and sexual concerns more openly. As a result, self-disclosure and treatment engagement increase. Online therapy offers various advantages, including accessibility, cost efficiency, privacy protection, and improved healthcare system scalability. However, it also has limitations such as reduced nonverbal communication and difficulties in emergency intervention. In particular, situations involving suicide risk, self-harm, or psychotic episodes may require immediate in-person intervention. Therefore, online therapy should not fully replace face-to-face treatment, but rather be used in a complementary way. Ultimately, the future of mental health care is likely to move toward a balanced and integrated model that combines both online and offline approaches.